Hi, this tape is on nasotracheal suction. We'll use a sterile suction kit first. The idea is not to touch anything along the inside. You can touch the outside. As you can see, I'm opening the kit very carefully, not touching anything on the inside of the kit. Now, I'll pick up the glove. You notice the glove is folded over. I don't want to touch the finger part here. I want to keep it on the inside, and I will put the glove on as such. This will be my sterile hand. I also have one dirty hand. I'm normally wearing two gloves, but I'm going to wear one glove just for demonstration purposes. So I'll pick up the dirty bag, pick up the suction kit as such. Okay. And the only part I can touch on this, as you see right here, is the part where I'm going to turn the suction on. There, straighten out the catheter, wrap it around my hand, attach it over here to the suction unit. See it or not, but I would attach it to the suction unit. I'm going to keep it wrapped around one hand, and the idea, of course, being that way I can use this dirty hand to disconnect the patient from the ventilator circuit or whatever needs to be done. Now, the next thing I'm going to do for nasotracheal suctioning is I'm going to put some gel, KY gel, lidocaine gel. I'll have it spread out over here, and I'll run it through. The idea is that lidocaine will act as a little anesthetic in the nose. I'll put it all over the tip. Now, when I run this in, I want to advance. I want to advance on inhalation and advance towards the midline. I'll run it in as such, twisting if I run into any obstruction, and continue to advance. Okay, and I'll end up advancing all the way to the end here. Now this is a mannequin, it won't go in all the way. Okay, now the trick, of course, is to get past the epiglottis. So I'll go in, and once the patient starts to cough, or if they won't cough, tell them to take a big deep breath. The idea is so the epiglottis will open, and then I can slide it in. They'll start coughing, I suction all the way out. I would then wrap my one hand and put my oxygen back on my patient, whatever it happens to be, nasal cannula, mask, whatever it is. And that's nasotracheal suction. I would then, of course, have to listen again. I should have assessed before to see if the patient needed it. If I need to go again, okay, I would then put a little more KY jelly and run it in, okay, through here. Okay, go and advance again. Now the trick again, I'll get about halfway, get past the epiglottis, tell them to take a big breath or cough, slide it in quickly, inhalation, pull it out, wrap it up, put the oxygen back on. Okay, that's nasotracheal suction.